Hello, good afternoon, doctors. On behalf of Hetero Healthcare, I, Dr. Prashant, welcome you to this webinar on PPH prevention with Carbetocin. Dr. At Hetero, as you all know, we market products in multiple therapy areas like in gynecology, dermatology, gastroenterology, pulmonology, orthopedics, etc. With a very strong R&D background, we try to develop products keeping patient benefit in mind. Our endeavor is to improve patient compliance and ultimately clinical outcome. We have developed NSAID patches, rivastigmine patches for patient compliance. Gynecology, obstetrics, and IVF is an important therapy segment for us at Hetero. Apart from oral tablets, conventional tablets like Didropal and Milotin, we market products for vaginal health like Feminora and Pelitra. We also market a vaginal film under the brand name Stelora, which is a lactic acid film. Recently, doctors, we have introduced Carbetocin under the brand name Carbiact. We know that Carbiact is used for PPH, and we know that PPH is a potentially life-threatening condition and requires intense management. To speak more about PPH prevention with Carbetocin, we have Dr. Ritu Santwani with us today. Welcome, madam. Welcome once again.
Thank you. Thank you. Thank you so much.
Dr. Ritu Santwani is MD, FICOG, FIACOCOG, AMR COG, and ART from Singapore. Madam is founder and CEO 360 Degrees Healthcare Studio, Director Sham Well Women Clinic and PTBC, co-founder MAAM, board member SWWS. Madam is a practicing gynecologist, obstetrician, infertility specialist, sexologist, and cosmetologist based in Koregaon Park, Pune. Dr. Ritu Santwani has more than 24 years experience in women's health. So today we are going to hear PPH management with Carbetocin from Dr. Ritu Santwani. Welcome, madam. Welcome. Good afternoon and welcome once again.
Yeah, good afternoon to everyone. And thank you so much, Dr. Prashant, for the kind introduction. So a very good afternoon to dear friends too. These all are the working days and we all are busy in our OPD. I also came rushing to my home to take this webinar because in the OPD always a lot of disturbance. Every after 2 minutes, someone will come and open my door. So friends, today we are going to discuss regarding the role of Carbetocin. So as we all are aware about this drug, since from the ages we all are using the oxytocin, then methergine, then we are using the prostaglandins, so for the management of the PPH. So now what is this new drug I'm using? I'm actually very fond of this drug. From last 3 years I'm using this drug only. I think 2.5, 3 years it is going to be complete, because most of my patients, earlier I started using this drug when I was delivering my patients of the twins or triplets. Being an infertility specialist, most of my patients are either twins or triplets delivery. Later on, I found such a good results that I totally switched over to this new molecule, the Carbetocin. So whenever I go for some meetings, a lot of doctors meet me, and knowledge sharing is my passion. So all have a one or the other confusion. Most of them have a confusion that is it like the same like oxytocin and it is used for the augmentation of the labor, because as the name resembles oxytocin and Carbetocin. So what are the confusions with this? So friends, this is a drug which is being evaluated for the prevention of the PPH. So today what I'm going to discuss only the medical management for the PPH. What's new in the medical management, not for the surgical treatment. For the surgical treatment, again, we can take a separate, because internal iliac artery ligation and what are the compression sutures, what other things we are doing, that itself be a very vast topic. So now I'm sharing the screen. What are your experience with using this drug? So if you can write in the chat box, so that will be good. So post my talk, we can discuss that also. Just making the full screen. So thank you once again, Hetero Healthcare and Dr. Prashant and Jyoti, Anjali and Bhaveshi for inviting me here. And thank you for our support. Mr. Vijay is giving the support. So thank you for that also. Good. My all presentations, national and international, starts with Mata Durga Stuti. या देवी सर्वभूतेषु चिकित्सा रूपेण संस्थिता नमस्तस्यै 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 नमो नमः. So friends, what's the new in the medical management of the PPH? What we are using since ages, and now what the superior drug has come? Because as we all are aware, our field is like that we have to be get upgraded day by day. So what the new thing is coming, new thing has come, and how we can use that, today we are going to discuss that. So before going to that, so now what is the incidence and what the statistics says about the incidence of the PPH in India? So friends, as we all know, PPH is the leading cause of the maternal deaths in India. The prevalence in India is around 38%. It accounts for up to 56% of the maternal death in India. The PPH impact on maternal mortality, 1/4 of all maternal deaths worldwide. PPH accounts for 35 to 56% of maternal deaths in India. We can see it's a very wider chunk. So now what are the most common directly causes for that? So friends, here we can see the maternal mortality. We can see the big chunk is by the hemorrhage, the 38%. Rest is covered by the unsafe abortion, obstructed labor, sepsis, and hypertensive disorders. So PPH is defined as a cumulative blood loss more than 500 following vaginal delivery, or more than 1000 ml following the cesarean delivery, or any amount of the blood loss within 24 hours after the birth, evidenced by a rise in pulse rate or falling BP. Primary PPH is within first 24 hours of delivery. Secondary PPH is within 24 hours to 12 weeks after delivery. So friends, purposefully, I put the background of the slide because we all know the famous monument Taj Mahal is because she died because of due to of the PPH only. So as we all know, we all have read about this 4 T's for the PPH. In our post-graduation, this is a very, very common question for our Viva. So friends, yes, T for tone, atonic uterus for 70%, trauma, laceration, hematomas, inversion, rupture 20%, tissue, retained tissue, invasive placenta 10, and coagulopathies constitutes around approximately 1%. So the most common cause of the PPH is uterine atony, which results from poor contractions of the uterus after the childbirth. So among this atonic uterus, friends, the risk factors are the prolonged use of oxytocin, high parity, chorioamnionitis, GA, overdistension of the uterus, twins or multiple gestation, polyhydramnios, macrosomia, multiple uterine fibroids, inversion of the uterus, genital tract trauma, either due to extended episiotomy or the cervical, vaginal, or perineal tears, or sometimes at the time of the precipitate delivery too, the retained placental tissues, and sometimes the coagulation abnormalities. So now what are the risk factors for PPH? So as we all are aware, the prolonged labor, grand multipara, augmented and precipitated labor, history of PPH, overdistension of the uterus, operative delivery, chorioamnionitis has been reported. So blood loss can be estimated by weighing of compresses, visual estimates, collecting devices, and the shock index. So the severity of the condition can be estimated by, so friends, here we can see, if then more than 500 ml accompanied by risk factors is the abnormal condition, more than 1000 ml is the severe PPH, more than 2000 ml is the massive hemorrhage. So now what is for this practice of the prophylaxis of PPH? So as we all know, the improvement of the health status of mother, hemoglobin more than 11 gram%, identify high-risk women, plan for institutional delivery, strict vigilance of all women in third stage of labor, practice active management of the third stage of the labor in all, examination of afterbirths should be a routine, explore uterovaginal canal following difficult, instrumental, and destructive delivery. These all are very important points. So WHO also recommends for the active management of the third stage of the labor for the prevention of PPH. So for this active management of the third stage of the labor, the bimanual uterine massage and simultaneously uterotonic agent administration has been reported. So the administration of this uterotonic agent is the most important component for the active management of the third stage of the labor. And it is claimed that it reduces the incidence of PPH approximately 50%, which is the major chunk. So a lot of studies have come that the incidence of PPH is high in the cesarean delivery, 6.75%, compared to the vaginal deliveries, 2 to 4%. So it is more likely to happen after cesarean as compared to vaginal delivery. Approximately 36% of cesarean deliveries are complicated by PPH. So it's a very common practice to give the uterotonic drug following the delivery of the neonate during the cesarean section. We are using in both, whether we are doing the normal delivery or doing the cesarean section. So studies have come in, this was at the 2019, which has shown the uterotonic agents like oxytocin and carbetocin are recommended for the routine administration immediately after the delivery of the fetus during the cesarean section to prevent the PPH. Administration of uterotonic drugs agents are very essential during cesarean section and in the third stage of the labor for delivery, and to diminish the risk of PPH and improve the maternal safety. Then what are the drugs we are having for this uterotonic drugs and how to classify this? So friends, as we know, we have to study in the category of the first line agents, in which we include, yes, the posterior pituitary hormone and analogs, the oxytocin and carbetocin, while amongst the category of the second line, the ergotalkylides, the prostaglandins and analogs, ergometrin, methylergometrin, then the PGE2, misoprostol and carboprost has been included. So earlier it was considered that oxytocin for the gold standard for the prevention of the PPH, but now a lot of studies have come. So friends, we all know the oxytocin, the half-life is only 4 to 10 minutes. It is a short-acting drug. The duration of action is 15 to 20 minutes, and it must be administered as a continuous IV infusion to attain sustained uterotonic activities throughout the surgical procedure and immediate postpartum period. The causes of the receptor desensitization is oxytocin is used for inducing or augmenting labor may desensitize the oxytocin receptors and thereby impairing the oxytocin's post-delivery effects on the uterine contractility. So, yes. Friends, as we all know, this oxytocin is the drug which has been used in the past decades in the dairy farming sector, where its properties as a lactation enhancer has been used to increase the milk production amongst the milk animals. So, studies, what I say studies, actually it's an order come from the September 2018 for prohibiting the private sector companies for manufacturing and distributing the oxytocin for domestic use. At present, only this KAPL is only the company which is manufacturing the oxytocin for the entire country. So the need of the drug is what? That we have to use a drug which should be a longer acting, single dose of administration, no variation in the dose regimens, devoid of repeated administration, ease of one-time administration, superior efficacy or similar efficacy as that of oxytocin, devoid of receptor desensitization and superior side effect profile over oxytocin. So friends, here we can see a lot of advantages by using this long-acting drug and the single dose of administration. This is also very, very important, and devoid of repeated administration and the superior efficacy. So now coming to the in detail that what is this carbetocin? Is it differ from the oxytocin? And so friends, carbetocin is a synthetic analog of human oxytocin with some structural modifications. These structural modifications increases the half-life of the carbetocin therapy, prolonging its pharmacological effects. So how does this drug act? It acts by acting through the oxytocin receptors, which causes the uterus to contract. So it is oxytocic, uterotonic, and anti-hemorrhagic. So this is the mechanism of action that it selectively binds to oxytocin receptors. Then IP3 promotes the release of the calcium from the intracellular cells, increases the intracellular calcium, formation of calcium chymodulin complex, stimulates the rhythmic contractions of the uterus. This is a small video. Please go through this.
A postpartum hemorrhage, or PPH, is an obstetrical emergency affecting an estimated 10% of all live births. It is the most preventable cause of maternal death. The uterine arteries pump 500 to 700 milliliters per minute into the site at which the placenta is attached to the uterus. After birth, this blood could potentially flow into the uterine cavity and be lost from circulation. In most cases of vaginal delivery, however, the myometrium contracts firmly, compressing the blood vessels and thereby reducing blood flow. A cesarean delivery can increase the risk of a PPH developing due to the insufficient contraction of the uterine musculature. Carbetocin specifically targets uterine atony. Carbetocin is administered as a single intravenous injection. After injection, carbetocin is carried rapidly to its site of action, the smooth muscle cells in the uterus. Here it binds to oxytocin receptors. In this way, a signaling cascade is started. As a result, the smooth muscle cells of the myometrium start contracting regularly. This causes the leaking blood vessels in the uterus to be compressed and to constrict. The overall effect? The bleeding stops and uterine involution is furthered.
So this is the half-life of this I am oxytocin. The single IV bolus injection of this will be effective as long as 16 hours of the continuous, as long as 16 hours of continuous oxytocin infusion. Sorry, friends, the slip of tongue that is. Carbetocin need no repeated administration, no dose variation. Single dose of carbetocin has been found to be effective in controlling the PPH. So it is superior over oxytocin with respect to its pharmacokinetic parameters and single dose administration. So a lot of studies and have come in the favor of this. The FIGO also recommends the drug regimen for the prevention and treatment of PPH in June 2021. And now we can see the PPH prevention prophylaxis and PPH treatment options. Amongst the treatment option, the carbetocin has a place. We can see 100 microgram intramuscular or intravenous over the 1 minute plays a good role. And we all know regarding the use of this oxytocin, misoprostol, ergometrin, and symptometrin earlier, and the prostodin, also the carboprost. So then the guidelines have come similarly from the FOXI that all the use of this oxytocin 10 international units intramuscular or 5 units IV diluted in 5 ml over 1 to 2 minutes slowly. What usually we practice in our practice from the residentship to that the 20 units in the 500 ml either NS or RL infusion or the misoprostol 600 microgram oral sublingual or parectal or the ergometrin or the carboprost. So I have used a lot of carboprost in my practice, means sometimes this intramuscular, sometimes most of the times I find a good results by giving this intramyometril too. Yes, though the side effects are very common, the nausea, vomiting, loose motions. So we have to give the pre-medication for that too. So by 2019 AICOG, the paper was presented for the carbetocin in atonic PPH. So the bioavailability of this drug is around 75 to 80%. It has a potent uterotonic effect on the pregnant and immediate postpartum uterus. No effects on the non-gravid uterus. So friends, the limitations by the oxytocin are that it is a short half-life, 3 to 17 minutes, and we have to give the continuous IV infusion. And the larger doses of oxytocin having some side effects. the hypotension, nausea, vomiting, dysrhythmias, STT, changes in the ECG, pulmonary edema, and severe water intoxication with convulsions has been reported. While with this drug, Carbetocin after single intramuscular administration, the side effects has been reported very less. So then the drug has been, a lot of studies have come by the WHO for the support of this drug. Then WHO also said that the not the carboprost but the Carbetocin they have recommended. Then the FIGO guidelines also, as I just discussed in March 2022, I have put the link also here. So Carbetocin 100 microgram intramuscular or IV is recommended for the prevention of PPH. So then this drug has been studied throughout the world. A lot of clinical trials has been done for this drug. So studies have shown that this Carbetocin versus oxytocin, it increases the incidence of atonic PPH, postpartum blood loss, additional uterotonic drugs, incidences of postpartum anemia, and adverse side effects. So the studies have shown the favor, all these studies going in the favor of the use of the Carbetocin. And I am happy that now that Hetero has also launched this drug. Earlier from the 5-6 companies are already making. Now the so we have seen, friends, by use of this drug, the need of the other additional drug for the with the usage of the Carbetocin has been reduced. So similarly, the chances of the postpartum anemia will be less. That it is IV Carbetocin is more effective than IV oxytocin for the prevention of atonic PPH amongst the singleton pregnancies with at least a 1 risk factor for PPH. So friends, here I want to clarify everyone that this drug is not only for the twins or triplets, but we are using this for the singleton pregnancy also. So giving a good results. So a lot of articles and studies in the favor of this has been presented. So I'm not going in detail that. So Carbetocin appears to be an effective new drug in the active management of the 3rd stage of the labor in vaginal delivery. Carbetocin can be considered as a good alternative to oxytocin in the active management of the 3rd stage of the labor in vaginal delivery. So friends, lot of studies and lot of clinical trials has been done. So all studies have shown the prevention of the PPH following the cesarean delivery. Lot of studies have come in the favor of this. So studies have shown no significant difference in the rating of the side effects between the oxytocin and Carbetocin. Side effects are reported highest amongst the misoprostol group. So friends, here we can see this is the category where the Carbetocin has been used, then the oxytocin, and where this misoprostol has been grouped. So we can see the blood loss is almost means 437, 439, well compared to misoprostol 583. While so in the bleeding between 500 to 1000 ml is 20%, while in these two are markedly high. So conclusion is the additional uterotonic drugs were needed less frequently by the patient treated by Carbetocin. Carbetocin appears to be an attractive alternative to compared to oxytocin and the misoprostol for the prevention of atonic PPH following cesarean delivery. So a lot of studies have come, friends, in the favor of this. So what are the salient points? I will show you that. So we can see these all parameters means the chances as the postpartum blood loss is less, so the chances of getting the blood transfusion is also less with Carbetocin, and it is considered to be more effective in the hours on uterine contraction and though the preventing the PPH in the multiple pregnancy patients undergoing the elective cesarean section. So a lot of studies have come in the favor of this. So So friends, this is another study which has been presented. Around 200 female scheduled and for elective cesarean section, either the use of this 100 microgram carbapenem or the international units oxytocin IV and 0.2 mg methergin. So lot of studies have come. So here, friends, we can see the carbetocin needed less added on the uterotonics. So friends, here we can see it is the more potent, long-acting oxytocin with less need for the other additional uterotonic agents and less occurrence of uterine atony. So studies have shown that outcome measures in the form of the above factors as I just discussed. So main importance of this drug is the reduction of the postpartum blood loss and more safety in the side effects of the drugs than methergin. So study has been supported by the this Cochrane study too. So friends, here this is a chart which is showing the use of this drug and comparison as I've just discussed. So this drug is efficacious and safe in maintenance of the uterine tone and limitation of the blood loss. So again, there are a lot of studies has been presented by the different this. So it is all considered to be superior alternative to over oxytocin, and due to its long half-life and unique action, whether the oxytocin requires the repeated injections or a perfusion for several hours with the variability of the administered doses. So friends, here we can see that this can be given, how to give this. These days, so we are getting the pre-filled heat stable form, so that is very good to give. So yes, this have also I discussed. So there are a lot of studies have come for the use of this drug in the twin pregnancies. So the primary endpoint is the change in hemoglobin risk of PPH and undiagnosed PPH, and the blood loss and the need of the uterotonic measurements and DNC. Studies have shown that adding of the carbetocin in addition to oxytocin decreases the blood loss for the cesarean section and in cesarean section with twin pregnancies. So these are a lot of studies in the favor of this. Among the different strategies also they have used and compared the results. Then studies have come by comparison of this drug with misoprostol. We all are aware now, a few years back, we all are using this few years back, what we are using is still in some patients that in spite of giving this drug, we are using the per rectally misoprostol, which is also having a good results. But now since the carbetocin has come, this will be the drug of choice. This is also the very recent paper presented in AIMJ in January 2021 only. So, yeah. So, carcinogenicity studies have not been performed with carbetocin due to single dose nature of the injection. So, friends, we can see it has been used for the safety and side effects similar to the oxytocin. So here, friends, we can see a chart which is comparing the carbetocin and carboprost. Carboprost we know is the second line agent in PPH, while carbetocin is the first line. While it is carboprost not recommended by WHO in the management of PPH, while this carbetocin by WHO in the management of PPH associated with severe vomiting and diarrhea. Carboprost, no such side effects with this of this. So the carboprost, as we know, contraindicated in asthma, while this should be used in caution with the patients of the asthma. So lot of studies have come regarding the safety of this drug. So now, though it is available in the heat stable form on pre-filled syringe also. So this carbetocin is proved to be non-inferior to oxytocin with the ease of the single dose administration. So lot of studies have come in the favor of this. So this carbetocin dosage and administration, the single dose of 100 micrograms should be administered IV as a bolus injection slowly over the 1 minute after the delivery of the infant. Then the studies have come studies have come that in the favor of this. Just a second, yeah. So friends, thus we can say this drug has to be considered as the superior compared to oxytocin for the prevention of PPH, blood loss after delivery, need of the additional uterotonic agents, deviation in hemoglobin levels, and need of blood transfusion will be less, perception of pain, and side effect profile. So this is superior to ergot alkaloids with respect to prevention of PPH. Blood loss after delivery, need of the additional uterotonic agents, need of blood transfusion, better side effect profile. So this is available in the heat stable form also. Friends, so this drug is considered to be superior for this and no such side effects has been reported with this. So now what are the contraindications? This is some very popular means the questions what we are getting whenever I take the talk for this carbetocin. So I made 3-4 PPTs for that. So it is contraindicated during pregnancy and labor before the delivery of the infant. It not be used for the induction of labor, hypersensitivity to carbetocin or oxytocin, epilepsy, some serious cardiac disorders, hepatic or renal disease. So it has been used in the pregnancy prior to the delivery. Smaller amounts has been used to pass from the plasma into the breast milk. So yeah. So no such drug interaction has been noted with this. Yes, the studies have shown, friends, that inhalational anesthetics like halothane and cyclopropin may enhance the hypotensive effects and weaken the effect of the carbetocin on the uterus. Friends, the studies have shown the blood and lymphatic system disorders, nervous system disorders, respiratory and thoracic, GI side effects, and skin and cutaneous changes has been reported. So friends, so we all know that all the pregnancies are at the risk of the PPH, even though no predisposing factors are present. So we have to remember that every woman in the labor is at the risk of the PPH. We have to be ready with all our emergency devices placed in the OT room only or in the labor room. So because the 3 Ds are very in causing for the 4th D, that is death. That is, first is delay in recognizing and seeking help, delay in the transport and reaching medical facility, and then when to shift. So friends, here we can see that how the lady is happy post the delivery. So lot of studies again have come. This is the one important question someone asked me when I've taken this webinar. So yes, I put in the PPT format. Yes, is the carbetocin have any effect on the lactating mothers? No, it has no such effects because it is broken down by the intestinal enzyme and minimal amount is transferred via breast milk. It is administered after using oxytocin for induction of can it be used? This drug can be used in the patients where the oxytocin has been used for induction of labor. Yes, friends, we can use in that patients. Earlier, if you had given the oxytocin, later on you can use this carbetocin also for the prevention of the PPH. Now, what about the asthmatic patient? Where we give this drug, yes or no? So still, the friends, the studies are going on. So yes, it can be given intravascularly or and is it required to re-administer this drug again? So no, usually no additional dose is required. The drug cannot be used for the induction of labor. Then can we prescribe this drug with tranexamic acid? Yes, we can prescribe. And studies have shown that this carbetocin gives the better results compared to misoprostol. No studies that this drug is causing some neonatal jaundice. So now the studies have come that this drug should not be used in the epilepsy patients, but why? So studies have shown that it is having an antidiuretic effect leading to hyponatremia, which can exacerbate the epilepsy. And what should be in the carbetocin used carefully in the migraine? Yes, the studies have come. So the patients who are allergic to oxytocin, so this drug is also not to be used. So thank you, friends, for your patient hearing. And I tried to simplify the slides, though it's a very vast topic. A lot of studies have come for this oxytocin. So learn from yesterday, live for today, hoping for tomorrow. The important thing is not to stop questioning. A very famous quote by the Albert Einstein. Now, last 2 slides, what I'm going to show, this is for my upcoming academic program. So friends, I would like to invite all of you for this academic marathon on 18 June 23 from afternoon 1 p.m. to 8:30 p.m. I invited approximately 14, the total 14 stalwarts all across the geography, and cherry on the cake that this is also free. So no registration charges. I also applied for the credit points. As soon as I get the sanction for the credit points, I will upload in the social media too. But meanwhile, friends, please block your time for this. I'm looking forward to seeing all of you again. So, yeah. So thank you once again.
Thank you, madam. Thank you so much. It was a wonderful session as usual.
Thank you.
Very
Thank
informative.
You,
Yes. One can realize the emergency that PPH can give.
Yes.
One interesting thing which I really did not know is the connection of PPH with Taj Mahal. It was a new learning for me. Yeah. You know, the way carbetocin, superiority of carbetocin has no, you don't require cold storage, a single injection, that to IM and IV, no drip required, no major drug interactions. I think over a period of time, it is going to replace oxytocin as the use increases probably. It's already on its way, but probably, yes, as the cost goes down and the use increases.
Very true, Dr. Prashant. And for this, we no need to give any extensive training to our staff.
Absolutely. That's very important.
As you clearly mentioned that first it has come now in the heat stable form. Now it is coming in the pre-filled syringe. So single dose is doing all the effects. So,
all pluses. Rarely you get all pluses.
So and I think we have to now create more and more awareness for this drug. So at least for the PHC also. PHCs maybe itne sare deliveries hote. So there also, if the ANM and ASHA workers will know that how to use this drug, so this drug can save I can say millions of lives.
And cold chain thing is a big thing in PHCs. Because there will be electric shortage and you know. So we can
Sure.
say that carbetocin can be used prophylactically in every delivery, as you said, to prevent PPH.
Yes.
But how common is oxytocin fatigue, or oxytocin people not responding to See, they use it commonly in second stage to augment labor. Eventually, in many patients, fatigue can come and they don't respond. How common is that fatigue coming for oxytocin?
You can say around, I think minimum 20 to 30% you can say. But frankly, if I can say you from last 3 years, so I have not used in any of my patients this because my patients mostly means earlier what was the concept in everyone's mind, but this drug is little costly and giving the prevention from the PPH. So especially if you are delivering the patients of the twins, triplets, you have to start using this drug. So, but now though I'm using in each and every patient, as I shown my slide, any patient can convert into the PPH. Means obstetrics is totally unpredictable. Now, any patient, what?
Someone has said correctly, expect the unexpected. You never know what can come when.
Very true.
And madam, even in the several causes of atony, like prolonged labor, which is the commonest cause of atony?
Over-distended uterus, most commonly is this only. Most commonly is this only.
Multiple
pregnancy. Yes. Means that created my interest for using of this drug. I start because we deliver mostly the patients for the twins and triplets. So once I find a very good results, so later on
obviously. Then you get confidence into that, no?
Yes.
How would you manage a PPH in patients with retained placenta in, say, second trimester of MTP?
Okay. So yes, in that patients also you can give carbetocin and you can give the manual removal of this manual removal of the placenta. If any difficulty, they can do it under ultrasound guided.
Absolutely.
Dr. Prashant, see, I have done this discussion with so many doctors regarding carbetocin. So still, this was my query also. I also asked there because as earlier what we are using this prostodine means carboprost what we are using. I had given so many patients the intramyometrial means सिझेरियन करता नाही म्हणजे त्या टाइमला आपण इंट्रामॅट्रियल दिला तर अजून मग ह्याच्यासाठी स्टडीज नाहीये स्टिल वी आर नॉट हॅव्हिंग द स्टडीज फॉर दिस carbetocin that whether we can give carbetocin for intramyometrial.
That's correct.
So usually we are giving the single IV dose and we are getting a very good result.
Correct. And your personal preference, what is the second line, like methergine or misoprostol or carboprost? If this doesn't work, oxytocin or carbetocin doesn't work, what would you prefer, methergine or misoprostol?
See, in my patients now, where I'm delivering the triplets, and triplets.
Very interesting.
In the triplets, yes, carbetocin is now my first of choice. Wherever I'm delivering in Cloud9, either in Ruby Hall or either in Inamdar, these 3 places. So carbetocin to har jagah hota hi hai. Additionally, I had already given the instruction to my residents ki whenever such patient is coming, keep the misoprostol handy. Then some patients we give the misoprostol correctly along with that.
Okay. Cold chain is very going to be a problem in our country. I suppose now, especially with this heat and the power shortage.
Being a tropical country, India being a tropical country, this is
it is going to be a problem. I think that is all the questions that we have. But then if there's something more, we'll definitely come back to you. It was a very interesting session, madam. Very interesting. And thank you once again for taking time and briefing us on this. Thank you so much. And thank you all the doctors for participating.
Okay.
Thank you.
Bye. Thank you.
Bye.